Hello, and welcome. Today I'm breaking down the critical flu symptoms you should never, ever ignore. The flu is more than just a bad cold. It can be a serious illness, and knowing when to seek help can make all the difference. Whether you're caring for yourself, a loved one, or just want to be prepared, this information could be life-saving. We all know the flu can knock you off your feet, but sometimes it's a lot more serious than you think. While most people recover at home with rest and fluids, there are certain warning signs that mean you need to act fast. I want you to be ready to spot the signs and act fast. Let's dive in. Remember, being proactive can help prevent complications and even save lives. First up, if you have trouble breathing or feel short of breath, don't wait it out. Breathing should never feel like a struggle, and if you notice it's getting harder to catch your breath, that's a major warning sign. This isn't just a stuffy nose. We're talking about struggling to fill your lungs, wheezing, or pain in your chest. If you hear a whistling sound when you breathe, or if you feel like you can't get enough air, it's time to take it seriously. That's a red flag. Get checked right away. Breathing problems can quickly become life-threatening, especially for young children, older adults, and people with chronic health conditions like asthma or heart disease. If you have a history of lung or heart issues, you're at even higher risk. Don't hesitate. Call your doctor or go to the emergency room if you're struggling to breathe. Next, high fever that won't quit. A fever is your body's way of fighting infection, but when it gets too high or lasts too long, it can be dangerous. If your temperature keeps climbing above 102 degrees, even after meds, or if you're shivering uncontrollably, it's time to take action. Persistent high fevers can lead to dehydration, confusion, and even seizures in some cases. High persistent fevers can be a sign your body's fighting hard or struggling. If you're sweating through your sheets, feeling weak, or can't get your fever down with over-the-counter medicine, don't ignore it. For children, especially infants, a high fever can be even more dangerous. If your child is under 3 months old and has a fever, seek medical attention immediately. Now, pay attention to confusion or sudden dizziness. The flu can sometimes affect your brain, leading to confusion, trouble thinking clearly, or even fainting. If you or someone you know gets really disoriented, can't wake up, or has trouble staying awake, don't brush it off. These symptoms can be especially dangerous for older adults or people with underlying health issues. Sudden confusion, slurred speech, or difficulty staying conscious could mean the flu is causing complications like dehydration or even affecting the brain. Don't wait. Get help right away. That's a signal something serious is going on. What about pain? Severe pain is never normal with the flu. If you have severe pain or pressure in your chest or abdomen, don't just chalk it up to being sick. Chest pain can be a sign of pneumonia or even a heart problem, while abdominal pain could mean a complication like dehydration or another infection. This could be your body's way of saying, "Hey, I need help now." Don't try to tough it out. Listen to your body and get checked. And don't forget about vomiting or diarrhea that just won't quit. While some stomach upset can happen with the flu, ongoing vomiting or diarrhea can quickly lead to dehydration. If you can't keep fluids down, dehydration can set in fast and become dangerous. Signs of dehydration include dry mouth, dark urine, dizziness, and feeling very weak. Dehydration is especially risky for young children, older adults, and anyone with chronic health problems. If you notice these signs, seek help before things get worse. Finally, watch for symptoms that bounce back. Sometimes you might start to feel better, only to have your symptoms return suddenly and even more intensely. If you start to feel better but then suddenly get worse again, especially with new fevers or cough, reach out to your doctor. This could be a sign of a secondary infection, like pneumonia, or another complication that needs urgent treatment. Remember, your body's pretty good at sending signals when something's wrong. Don't ignore what it's trying to tell you, even if you think you're just being cautious. If you notice any of these symptoms, trouble breathing, chest pain, confusion, severe vomiting, or a high fever that just won't break, don't wait. These are not normal parts of the flu and could mean something more serious is happening. Get medical help as soon as possible. It's always better to be safe and get checked out than to risk serious complications. Stay safe, pay attention to your body, and don't be afraid to get help when you need it. Trust your instincts. If something feels off, it's okay to reach out for support. For more health tips and straightforward advice, hit that subscribe button. Take care and see you next time. And remember, your health is always worth protecting.